Low back pain is a really common condition. In this episode, we'll discuss what causes low back pain and what you can do about it. Let's start off with talking about the anatomy of the low back. So the low back is made out of 5 lumbar vertebrae. You know what? I got a better idea. That's much better. So the low back is made out of 5 lumbar vertebrae. So we have 1, 2, 3, 4, and 5. And so each vertebra consists of a vertebral body, a transverse process, and then a spinous process. So the spinous process is actually what you feel when you just poke on the low back. That is the bone that you're feeling. And so most of these are where muscles attach. We also have the tailbone, which is called the sacrum. And then we have the ilium over here, which is the hip bone. And then we actually have the leg, which is called the femur over here. As for joints, there's a couple of main ones that I think we should know. So we have facet joints, which are right here, which is where a lot of the flexion and extension of the back comes from. We also have the SI joint over here, which is named for the sacrum and the ilium. And so if you feel on the back, you can feel a big bone right at the bottom. That's this part, which is the PSIS, or posterior superior iliac spine. It's just a bony prominence. We wouldn't be talking about low backs if we didn't talk about discs as well. So in between each vertebral body, there's a little cushion pillow here, which is called your intervertebral disc. And so why that's so important is that it's been implicated in a lot of pain syndromes for the low back. And then also when we have a disc herniation or a disc bulge, we can see that it's close to the nerves as they come out. So if we have a true case of sciatica, the compression of the disc on the nerve can give us that numbness tingling down the leg. The most common question when you have low back pain is, why do I actually have low back pain? Most of the time there's not a specific injury. It's not like you were out deadlifting 1,000 pounds, you felt your muscle tear, and then you went, yeah, I know why I have low back pain. I tore a muscle while I was deadlifting the other day at the gym. Most of the time, there might be a subtle injury that you might think of, like, oh, I went down to tie my shoes, or I was trying to pick up my kid, and then I felt my low back pain, but generally that's not enough to strain a muscle or sprain a ligament or anything like that. So most of the time, we don't actually have a specific cause of low back pain. This is why a majority of the low back pain cases are considered non-specific, meaning that there's no specific tissue that can be attributed to the pain. This means most of the low back pain cases are going to be multifactorial, so we can have some biophysical causes, of course. So there could be some muscles involved, ligaments, joints, disc, all that kind of stuff, nerve roots, all that kind of stuff can be involved in low back pain, but it doesn't always explain the whole picture. Psychological factors can also be involved with low back pain, so depression and anxiety have both been linked to low back pain as well. And so you could either have low back pain for a long period of time and then develop either depression or anxiety, or it could be the opposite. You can have depression and anxiety and then develop low back pain afterwards. And this is most likely probably because the nervous system has become sensitized. And so whenever you're trying to move, your body's trying to protect itself from some sort of threat, whether actual threat, i.e. a lion trying to catch you out on the field or something like that, or your body just thinks there's a lion all the time, whether it's stress from work or relationship or something like that. And so your body's in high alert, and so it's going to generate pain and try to protect yourself from that situation. Another part of the psychological component is pain catastrophizing. And so what that means is that we basically think that the problem is bigger than it really is. And this is really common with low back pain because typically it can be really severe, but you can't see anything that's going on. It's not like you were, in the example before, deadlifting 1,000 pounds. It just seemed to come out of the blue. So typically your head goes to a very bad place where you think, oh, there must be something really wrong with my low back. However, those sinister pathologies make up a really small percentage of low back pain. It's typically less than 1%, and generally those causes are a vertebral fracture, which are very uncommon in the population less than 50 years old, or you could have some sort of infection or tumor or something like that, but generally you'll have other symptoms involved besides just the low back pain. The third factor that can be involved with low back pain are social factors. So generally not really emphasized when we're looking at low back pain, but are actually pretty important. So if you're having relationship problems, financial problems, education issues, all these factors can play a role in low back pain cases. Stress is stress. So if you're stressed out for something like that, your body's going to try to protect itself, so it can manifest as low back pain. And of course, for every case, all these factors will vary a little bit. So maybe it's someone who went to the gym where the biophysical factors are a little bit more important than the social factors. Or if it's someone in college who's, they're struggling to get through, the social factors might be a little bit more important than the biological factors where they're not really exercising. So you have to take each low back pain case on its own and look at it when you're making a treatment strategy. So a quick little note here on imaging. So when we have low back pain, it's common to want like an X-ray or an MRI to look into the spine to see and make sure everything's okay. But that's actually not recommended in any of the guidelines. So all the guidelines say that unless we're suspecting a sinister pathology, so like we were talking before, cancer, infection, disc herniation with some sort of nerve issue. So we're typically talking about drop foot or bowel bladder dysfunction, so you just can't control going to the bathroom. Those are cases where imaging is warranted, but in most cases, X-ray and MRI aren't going to give you that much information about a clear pain driver. They're usually more related to age-related changes than they are to pain. So what does the evidence say are effective treatment strategies for low back pain? Well, for acute low back pain, which is classified as low back pain that's less than 6 weeks, the advice is to remain active and then also to give education. So almost reassurance that there's no sinister pathology like an infection, cancer, anything like that, and that the low back pain, it'll probably go away in a couple weeks on its own. If we need some adjunct therapies to kind of help, whether the pain be too severe where you can't perform your activities in normal living, something like that, then we can use spinal manipulation, massage, or acupuncture to help decrease the pain of an acute low back pain case. For persistent low back pain, which is low back pain that's lasted for over 12 weeks, the advice is similar to acute low back pain in that we're going to advise people to remain active and then also give them some education on low back pain. The difference is that we'll start doing exercise and then we can also do cognitive behavioral therapy as first-line treatment strategies for persistent low back pain. For adjunct therapies for persistent low back pain, we still have spinal manipulation, massage, and also acupuncture, but we'll add in yoga as well. So there's a couple interesting things here when we look at exercise specifically. One, exercise actually wasn't recommended for acute low back pain. So anything under 6 weeks, exercise was only beneficial in a select amount of people. So we want people to stay active and they can still do some sort of exercise, but it actually hasn't been shown to be that effective in reducing acute low back pain. The second point is that no one form of exercise was shown to be superior to others. So typically when we think about low back pain, we think core. So we need to do planks, side planks, glute bridges, all of these exercises to help strengthen the core, and that'll help reduce low back pain. This might seem like a bad thing because low back pain, there was one treatment strategy. We would strengthen the core. But this is actually a beneficial thing because it gives us some freedom. If you don't like planks and side planks and all that kind of stuff, we can explore other exercises to help decrease the pain. For example, let's say that walking helps decrease the pain. Well, we can use that and just go for a walk every day, a couple times a day, whatever it is, and that can be your exercise program for low back pain versus slugging through some planks and side planks if you hate them, and let's be honest, if you don't like them, you're probably not going to do them anyways. So to summarize the treatment strategy for low back pain, we generally recommend a non-pharmacological approach first. And so that means that we're going to try to stay active throughout the low back pain case. We're going to give some education on why you're having low back pain and try to figure out if there's any other factors, whether it's psychological or social factors that are also driving the low back pain. But then also we're going to add in some exercise as well. And if we need to, we can do some spinal manipulation, massage, acupuncture, and yoga to kind of help facilitate moving and getting back to whatever activity it is you want to do in your life. Thank you guys so much for watching another episode of Monday Mornings with Michael. I hope that you guys found this information useful. If you did, please like this video and don't forget to subscribe. Until then, I'm just going to hold this plank until you go ahead and push subscribe. Go ahead and push subscribe. I don't know how long I can hold this plank. Just click that button right there.